Hi John, this is my little presentation for schmorl node. Many people don't understand it, so I just prepared a small talk that explained it. Hopefully you will like it and understand it better. Okay, here is the MRI of the spine that you see. Here's the head, has cervical spine here, thoracic spine, and lumbar spine. The lumbar spine that zoom in become a diagram here. The yellow part is the vertebral body, and between the vertebral bodies are the so-called disc, intervertebral disc. That what they call. There are longitudinal ligaments that on one on each side that limited the motion of the disc. Basically, the vertebral body you can consider as a brick, and the disc considered as a rubber between the brick. So that function as a cushioning device. Here is a lumbar spine. Then you can see in the lower left corner there's an arrow pointing at a herniated disc. You can see that disc looks different than the one level above. That is protruding posteriorly into the spinal canal, compressing on the nerve roots. On top, where I mentioned schmorl node, that is a disc that protruding into the vertebra itself, not into the spinal canal. Basically, that is a focal fracture of the bone, and the disc protruding into the vertebral body through this fracture. That usually causes central back pain, rather than radiculopathy as you've seen in the lower lumbar spine that's compressing on the nerve roots. So basically, in young patients, especially age 11 to 30, mostly teenager, the disc usually is stronger than the bone. The bone is still growing, it's still soft, and those people are beginning to take on the tasks that adults are doing. So they're doing axial loading activities such as weightlifting. So basically, the extra stress are basically displaced onto the immature bone, and the bone fracture, and then the disc herniated into the bone. For elderly patient, then the bone become weaker, uh, and there's focal increased stress that also can happen for different reasons, which I'll explain later. This schmorl node is very frequently seen, more than 50% of the time in CT or MRI. People have something like this. So most people are asymptomatic, not symptomatic. So people don't pay attention. Some are, but a lot of people don't know about it. That's why I'm making this short video. Um, the symptom is sort of central non-radiating pain, and this pain can be controlled by medicine. Self-limited, just like any fracture, as long as they're not malaligned, you just wait it out, the body will repair itself. And in the meantime, you can take pain control medication and to get by. For example, this one. This is a 30-year-old male, came, I think, for some other reasons, not for back pain. You see the normal person on the right, the spine is quite aligned on the right side. On the left side, you see there's more kyphotic, hunch over kind of appearance. You can see the end plate. So on the left side, you see the end plate look irregular, not straightened, and they are just lumpy bumpy. This patient turned out that he started heavy construction work at age 13. So at that time, all those end plates are damaged, and the result result is the disc look irregular and the vertebra look irregular, and the patient has this kind of kyphotic deformity. This is so extensive, and also there's wedging deformity, basically a little like a triangle. It's not triangle yet, but the anterior border of the vertebra is shorter than the posterior border, not like the normal side. So basically that result in a wedging, we call it wedging deformity, and that's why people get kyphosis. And this is so severe, it's called a different name. It's called Scheuermann's disease. Basically, this multiple schmorl node with wedging deformity, and then in skeletal immature patient. Next one. For example, this patient, 51-year-old, that just came over to me a few days ago, complaining of back pain. She circled pain right here in the back. She mentioned that first injury was 2 years ago, and second injury was 2 weeks ago. She didn't specify the detail. It turned out that the first injury was 2 years ago was a motor vehicle accident, have a severe car accident. And the second one was she's working in the yard and felt a sudden back pain when she hunched over. So this is the MRI 4 years ago, before the motor vehicle accident and before this acute pain. This is today. You can see the difference between now and then. You can see a wedging deformity of this vertebra as a lower thoracic spine. I think it's T11 vertebra. The anterior part getting shorter, and there's a herniated disc into the vertebra. You can even see a subtle fracture line parallel the schmorl node, which is the intravertebral disc herniation. Turn out the wedging deformity is a chronic deformity that happened 2 years ago. That is a car accident result in this compression fracture of this vertebra, and patient healed. But the disc containing extra stress because the alignment is not as straight as before. So the disc somehow weakened, and there is altered stress on the vertebral neck door, and then herniate into the vertebra and causing this compression fracture now, which is we called schmorl node. This is an elderly patient, have weakened bone. This patient is 70-year-old with history of prostate cancer, have sudden onset back pain. So the referring clinicians questionable, they're raising question of whether the patient have metastasis. Did an MRI. This part is equivalent to this part of the spine, the lower lumbar spine, and you see this focal disturbance of this vertebral bone end plate, which is a black line. The black line is supposed to be contiguous like there, and then turn out that here is not. So if you have any questions, just email this Gmail address, so I will try to make my video better. Thank you.